Hello everyone, today's we are talking about Canada's 2024-2026 Immigration Levels Plan includes healthcare and housing. The Immigration Levels Plan 2024-2026 was announced on November 1 by Immigration, Refugees and Citizenship Canada, IRCC. For the following 3 years, the establishes a target for the number of admissions to Canada as permanent residents. In 2024, Canada plans to accept 485,000 new permanent residents, and in 2025, it will accept 500,000 per year. The idea, according to Immigration Minister Mark Miller, would stabilize the amount of immigrants entering Canada, which has alarmed a lot of Canadians. According to a recent Environics Institute survey, Canadians are not as supportive of higher immigration levels as they were in the past. According to the research, individuals who had stopped supporting the government expressed concern over home affordability in Canada. The minister acknowledges these worries and states that a thorough strategy will be implemented to ensure that Canada's current population is sustained while also meeting the country's labour force demands. In an official statement, he stated, "We recognize that housing, infrastructure planning, and sustainable population growth need to be properly taken into account. With the help of this plan, we are achieving the right balance to expand the Canadian economy while upholding our humanitarian heritage, encouraging immigration from francophone countries, and fostering more cooperation in level planning with our allies. Canada will always be a welcoming country that makes sure immigrants are supported in their new lives." What is the impact of the Levels Plan on Canada's labour force? The day after the IRCC published a new report outlining the department's revised immigration strategy, the Immigration Levels Plan for 2024-2026 was tabled. The report's main tenet is to encourage Canada's labour force expansion. In light of this, throughout the course of the next 3 years, more than 60% of new immigrants will arrive through economic class immigration channels, such as controlled express entry programs, the Provincial Nominee Program, or other regional economic immigration initiatives. Canada will accept 281,135 economic immigrants in 2024 and 301,250 in each of the following 2 years. A whole-of-government approach to immigration is another component of IRC's new policy, in which IRC talks with relevant parties. This strategy will assist IRCC in determining whether immigrants will get adequate support upon arrival. In addition, the strategic program states that the IRCC intends to collaborate with partners to enhance international credential recognition in order to facilitate the application of talents by more newcomers, therefore contributing to the large number of skilled immigrants. Additionally, it intends to raise awareness of financial aid programs including loans that might assist immigrants in covering the expenses related to the credential recognition procedure. In Canada, healthcare and construction. In addition, the IRCC said that bringing in a large number of immigrants to cover labour market needs will assist Canada fulfill its national housing strategy when it unveiled the Levels Plan. In order to reduce costs and increase the number of houses built in Canada, the housing strategy intends to invest about $82 billion over the following 10 years. More skilled labourers in the trades and construction will be needed as a result. Concerns over Canada's healthcare system are likewise shared by the populace. As of August 2023, 136,000 people were receiving healthcare and social assistance, according to Statistics Canada data. During the COVID-19 epidemic, when many healthcare personnel were regularly compelled to work overtime without a break, the strain on the hospital system became particularly evident. As a result, several healthcare workers became burned out and changed careers. Furthermore, by 2030, up to 9 million Canadians are predicted to retire, putting more strain on the system as the country's population ages. Despite the fact that over 468,000 immigrants work in health-related jobs, according to Census 2021 statistics, there are still not enough workers to cover all available positions. Description-based express entry. IRC started offering invites for express entry rounds with category-based selection in May of this year. The purpose of these new categories is to focus on express entry applicants who possess certain qualities that would enable the IRCC to carry out its missions. The groupings are: 1. Medical care. 2. Jobs in STEM fields. 3. Deals. 4. Transportation. 5. Agri-food and agriculture, and 6th grade French language ability. The IRCC chooses people through these category-based rounds who are better suited to cover labor shortages in industries like construction and healthcare that have high job vacancy rates. 5,600 candidates for healthcare jobs and 1,500 candidates for trades occupations have been invited by the IRCC thus far. According to Christian Fox, the Deputy Minister of Immigration, there will be one more draw for trades vocations before the end of December. According to the Levels Plan, Canada will accept 110,770 applicants for express entry in 2024 and 117,500 in 2025 and 2026. We appreciate you joining us as we examine Canada's Immigration Levels Plan for 2024-2026, with an emphasis on housing and healthcare in particular. Building a prosperous country requires striking a delicate balance between immigration and basic services. Please remember to like the post, subscribe for future updates, and ring the bell if you thought this information was helpful in order to receive updates on our next insights. We all have a role to play in Canada's path towards a better future, and we are thrilled to participate in this discussion. Until the next time, continue to learn and participate.
That is over today in video. Thanks for watching entire video. Hopefully information useful to you. See you later in next video.